And we'll begin the session. So again, this is Engaging Administrators in Collegiate Recovery, and our guests are Genie Kim and Denise Woods. Do you have a preference? Which one of you would like to go first?
I don't mind going first.
Great.
I can go first.
Denise, you are our first speaker. Welcome, and we look forward to hearing from you.
Okay, thank you. So I'll go ahead and share slides here. So hopefully everyone can see this. So good afternoon, everyone. Thank you for having me. I know we have limited time today. And so let me go ahead and start my video here too. I know we have limited time today, so I'm gonna take a break from a long-standing conference presenter's rule by saving the long intro and jumping right into it. Let me see here. So I always like to start off presentations with a grounding question or some type of purpose check. And so for today's session, since this is a session on collegiate administration and how we can help in recovery efforts of students, my focus today is really on holistic support and what can colleges and universities do to support student retention, graduation, and success through out-of-classroom programs and services. So what I'll attempt to get through today, I'll give a quick background on myself, touch on the framework here at UCR that we use to connect students through those out-of-classroom services to help foster success in a holistic way. Then I'll tell you a little bit about what we're doing at UCR specifically for students in recovery through our work, some of our work in student affairs, and then finally wrap up how we can and will continue to move critical services forward. So a brief background on me. My current role here at UCR is Assistant Vice Chancellor of Student Affairs. I've been here for a little over a year, which in COVID times, some may argue is about the same as dog years. So it's really been about 6 or 7 years, or at least it feels that way. My background is in public health with a focus on chronic disease prevention, eliminating health disparities, strategies to improve population health. Before coming to UCR, I was in the inaugural role of Director of Student Wellness and Basic Needs Initiative at the California State University System, Office of the Chancellor. There, I provided guidance and oversight to all of the 23 campuses, wellness and food and housing insecurity programming, as well as oversight to the student health services and counseling centers on all 23 campuses. Here at UCR, my portfolio focuses mostly on health and wellness programming on the campus, which I'll go into on the next slide. And the picture here, since we're kind of in this new era, everything's remote, we're just tearing down norms. Instead of having my headshot here, I decided to post this picture because it takes me to my happy place with my two BFFs, my children. Cooper on the left, who's 5, and my daughter Jade, who's 3. So the departments listed here represent our student health and well-being cluster here at UCR. There are 7 departments here: the Student Disability Resource Center, Recreation, Counseling and Psychological Services, the Well, Student Health Services, Student Affairs Case Management, and Basic Needs. So there's a wide variety of programs and services to serve a broad, diverse, and ever-changing student population. The crux of what we do, and what we have always attempted to do, is to create a culture of wellness and to weave it into the campus fabric so that it is felt and respected across the whole campus. And so our framework is focused on 3 main areas. Creating a infrastructure that prioritizes a holistic approach to student wellness, making sure that we increase the ways in which students gain access to the services they need, and really finally branching out communication and education of these out-of-classroom supports that can help students through recovery, through mental health challenges, students who need accommodations, basic needs, insecurities, and other barriers to student success that may arise. So first off, to create an ecosystem, there are a lot of levels and layers to it, right? It's complex. But what's most important is that all of those different layers and levels are connected. It's a network and it's all encompassing. And that's what we want to strive for here at UCR, a place where students feel supported fully, wholly, and that there are wraparound services that are robust and provide what's necessary for each individual student to feel they can be successful. I know that in the past and even currently, there's a focus on implementing what's evidence-based. We're at an R1 university after all. But in these times, there has started to be a shift of taking anecdotal information and feedback from students and using that to establish a best practice-based program, and then evaluating and measuring to take that from a practice-based program to evidence-based. So we're constantly looking to shape and morph and build this ecosystem of support. Secondly, we want to focus on increasing access. This is definitely an area we need to improve here at UCR. Partly, we need to improve our communication so that students know what we have to offer to support their success. But more importantly, we need to make sure that we're paying attention to student feedback so that we understand the need so we can support the demand. We also want to make sure that we're looking at the data trends and themes on campus so that we're actually flexible to change and provide a variety of services because we know that one size does not fit all. Additionally, we want to meet our students where they're at rather than the other way around. In doing this, we can build trust and in essence, increase access when students realize that we are committed to every student having the opportunity to be successful here at UCR. Finally, we want to create a culture that normalizes help-seeking behaviors and lessens stigma for those students that need guidance. Wellness should be a campus-wide effort. Every unit, department staff, and faculty needs to buy into the fact that we need healthy, attentive, connected, active students. This means that we have to educate our faculty and staff on what a culture of wellness means so that they can help students navigate those supports effectively. Faculty, whether they know it or not or admit it or not, they're often seen as gatekeepers to students. So they need to be armed with information so that if and when they encounter a student that feels like they're in crisis or just want someone to talk to, that they can advise the student quickly and appropriately. And we want to widen our safety net so that students who in the past may have felt uncomfortable with coming forward can take part in this renewed culture of wellness, a culture of belonging, and get the help they need without shame or, or that stigma. So at UCR, specifically in student affairs, many of our recovery programming efforts have come out of our partnership with various campus organizations and the WELL, which is our Health Education and Promotion Department within Student Affairs. Last year, the WELL co-hosted the Healing Highlanders group, which is an organization designed to provide a nurturing and affirming environment where recovering students can interact socially while pursuing academic, personal, and professional goals and enhancing quality of life. We also had the Nurture Your UCR Heart campaign, in which the WELL connected with various partners to promote sober activities. And again, as we're pushing for inclusivity and really spreading this culture of wellness, we again look to increase access, raise awareness, and participation by working with a variety of partners across campus and beyond. I also just added some stats here from our online program, Alcohol EDU. I think what stands out here is that 30% of students are interested in events that do not focus on drinking as the main activity. So we need to capitalize on that and have these students as ambassadors to other students. So we are really pushing that message of their other activities and lifting those up as best practices for students as an example. Another stat I did not put on here is that 13% of students said that they're either thinking about, ready to, or currently trying to drink alcohol in a safer and healthier way. 30% may not sound like a lot, but when you have a campus of 25,000, that's a good number of students. So in summary, we're looking to continue building that ecosystem that supports students, all students, to the best of their abilities, and to remove as many barriers to success as we can. We're also committed to improving access so that more students feel comfortable coming forward, and we have enough resources to support any student that needs help. And really, the overarching theme here is to weave wellness into everything we do so that awareness is high and people feel connected. So with that, I'll go ahead and say thank you for listening, and I'll stop sharing and go ahead and pass it on.
Thank you, Denise. Does anyone have any quick questions or comments from Denise? We will certainly have time after Genie presents. But if anybody had a quick question, I look forward to the discussion. I have some questions myself, but none that are burning right now. Okay, thank you, Denise. Genie, you have the floor now.
Hello, everyone. I'm going to keep my camera off just for bandwidth issues. I've been getting kicked off of Zoom, so hopefully y'all can hear me. And if you're having trouble, just feel free to send me a chat and I can keep monitoring that and see that come through. But thank you all so much for having me on this panel discussion and this opportunity to talk about collegiate recovery. My name is Genie Kim. I'm the current Director of Student Mental Health and Wellbeing at the University of California Office of the President. And I serve as a system-wide director to support everything related to the continuum of care from prevention, early intervention, treatment, and recovery within the subject matter of student mental health and well-being. And I've been in the role for just about almost 2 months now, and prior to that, I was at Cal Poly San Luis Obispo, as well as UC Santa Barbara, where I had the opportunity and pleasure of jump-starting and supporting collegiate recovery on both of the campuses that I was at. And so from my perspective, as I talk to you all about being able to establish, a collegiate recovery program or sustain a collegiate recovery program on your campuses, I think the most important things to consider are funding, strategy, sustainable support, and then being able to demonstrate the outcomes of your programs. As I mentioned before, I think the continuum of prevention, early intervention, treatment, and recovery is absolutely imperative to the work that we do, especially when we're looking at student success and ensuring that our students have all the services and programs that they need to be healthy and well on a campus. But I come at it from more of an equity framework, right? And when we're thinking about our students who may have experienced trauma or adverse childhood experiences, or have already been in treatment for substance use disorders, we have to look at prevention and early intervention and treatment and support as a strategy for success for our students. And that absolutely includes collegiate recovery communities and collegiate recovery programs that can help support that sense of belonging for our students who absolutely need those services and resources. So I'm going to go a little bit backwards and talk a little bit about some opportunities that I had on a campus to be able to advocate for resources in establishing a collegiate recovery program or a collegiate recovery community. And I've been listening in to some of the sessions throughout the conference, and this idea of where do we find the funding? How do we get started? Were a lot of questions that came up. And I want to say you don't need, $100,000 to be able to establish a collegiate recovery program. I think the most important is just having the people and the students there who are willing to help support, as well as the advocates and the staff who are willing to commit to help support. So it definitely can be a very grassroots effort in developing a collegiate recovery program. And I would say when I was at UC Santa Barbara with my colleague Angie Bryan and Jackie Curta, we received some seed funding from the Stacey Mathewson Fund, which helped us to just get started, even just finding a closet and, gutting the closet and putting in a refrigerator and a microwave and a couch, you know, and that was the space, right? And we've talked about these tiers as needing to provide, you know, substantial space for our students to build community, as well as access to professional staff that can help support them in their collegiate recovery journey. But it starts with just a few little things that can help establish the program, and then going into the strategy aspect of it, looking to your allies who recognize and understand what collegiate recovery actually means. And I would say that, you know, when I was at UC Santa Barbara, we had incredible support from administration in terms of understanding what the benefit was for a collegiate recovery program, right? The stigma, you know, reducing the stigma of thinking that it's wrong that we would be attracting or that we have a problem on our campus, rather than thinking of it as a bad thing, thinking of it as a positive thing, and that we're recruiting talented, amazing students who have overcome so many challenges and barriers to be able to persist to graduation. And then when I was at UC Santa Barbara was the opportunity for me to connect with the Haven at College. And Sharon Weber, the executive director there, was, you know, a huge friend and ally to be able to connect with and talk to talk about other strategies and sustainable strategies for support. And, you know, just thinking about this community and this network of folks who are there to support and provide guidance, I think is another absolute strategy for success, right? You can't do this work alone. It can be really challenging. It can be really daunting. You'll definitely come across folks who still have stigma and resistance to thinking about recovery programs. But thinking about our allies and the folks that are in the field who've been doing this work for quite some time. So the third area of focus, especially when we're thinking about funding, that I've heard in other sessions as well, is donor support. And that's exactly what happened when I was at Cal Poly, was we, you know, came across a donor who was really interested in starting a collegiate recovery program. And I had an administration that was really interested in data and metrics, right? And so that's where we were able to partner with the Haven at College to do a community mapping effort to really look at, you know, what is the state of recovery programs within our area of San Luis Obispo County, and where are the gaps in terms of being able to provide services for our most vulnerable students who are in the age group of 18 to 24. And, you know, having that executive summary that, you know, calls out that there are literally no services within a 100-mile radius of San Luis Obispo County to support our students really helped me sell to our administration the benefit of being able to start a collegiate recovery program. It helps that we had donor support as well, but I feel like that has set the stage for being able to continue to advocate for sustainable funding on that campus. But now stepping into my role now as a system-wide director for the University of California, when I think about collegiate recovery and I think about the benefits that a collegiate recovery program can have on an individual campus, I think the most important thing for me is to work closely and collaboratively with the campuses that have established collegiate recovery programs, start doing some benchmarking, gathering data, and then demonstrating, you know, and advocating for state and federal policy that helps advocate for more resources for our campuses for all 10 campuses to have a collegiate recovery program. And I would say what's really important is continuing to grow and build these bridges and these connections with each other within the system as well as externally, and thinking about the power of collaboration between the CSU, the community colleges, and the UC, and our collective impact that we can have on advocating and advancing collegiate recovery programs. So in a nutshell, you know, just a little bit of my experience both on campus as well as now in my role as a system-wide director. I'm absolutely excited and thrilled to continue to be working closely with folks on this specific topic.
Thank you for that. So the floor is now open for discussion. If people have questions or comments, I have some if nobody else does, but I will wait patiently for our guests to share any questions or comments they have.
Hi, this is Alex Coolman. Can I just say?
Yeah, go right ahead, Alex. Thanks.
Okay. I don't have a question, but I am a UCR alumna, and I was actually part of Healing Highlanders many, many years ago. So Francis invited me to pop in. So I've been hanging out on some of the different sessions, and I'm just so encouraged to hear about all of the growth that UCR specifically has attained over the last few years. I graduated in 2016, and so I'm super excited that Denise, you're on board now. Dr. Genie is on board, and you as well, and there's a great community here. So I just wanted to say thank you for all of the work that you're doing and for supporting new classes. I really appreciate that.
Thank you. Other questions and comments? Okay, well, I have a burning question, so I'll just throw it out there. Yeah, so thank you both for your presentation, your presentations, and sharing your perspectives. So I just wanted to push back a little bit and get more of an understanding about the calculus for allocating resources, right? So I'm still hammering away on this idea of getting official financial sort of sustained support. Jeannie mentioned, you know, you can do a lot at the grassroots level without a lot of funding, and I agree, and I think UCR is a good example of that. But I also think UCR is a good example of the limitations of grassroots efforts, right? Healing Highlanders, we had space, and there was a location, and now we don't anymore. And of course, we're working our way back, but and a theme that has come up a lot in our efforts to engage the community across the UC campuses is that you see sharp differences between campuses that have formal funding to support, you know, collegiate recovery and those that don't. And those that don't talk about how, yes, you know, thank goodness there's something, but they spend a lot of time trying to survive when they feel like, and I don't mean survive in terms of recovery, I just mean survive as an resource. And anyway, so all that is to say that, you know, our goal, I think our interest is really trying to understand how do we get collegiate recovery to be understood as essential. And for example, going to Denise's talk, like, so you have that lovely pie of the kind of offices and services that you oversee. And unless I'm mistaken, like basic needs wasn't there even a couple of years ago. It's a new area. And I just heard, so I used to donate like financially to the food pantry, but you know, Devin was like, well, we just got a huge grant. So, you know, you might consider there's other funds that you can donate to right now that might be able to use the money. So that's great. Like, I'm super excited that that's like, now it's an institutionalized pillar. So I would like to understand, how did that transformation happen? And, you know, because maybe there are lessons for us to frame collegiate recovery as, you know, an essential service or even a basic need kind of thing. So I'll stop there, and yeah, because I think, so part of what I'm interested in, yeah, is the calculus for how do you determine what makes the cut. So for example, you know, Denise, looking at those pieces in the pie, like, you know, collegiate recovery isn't a piece of that pie, but so there must be, you know, there could be many other things that could go into that pie. And so you're always having to choose because, you know, everybody gets it, resources are finite. So what is the ultimate calculus for kind of what's in and what's not? So it can't just be cost because there's money for those other things, right? So, and I know this is a long-winded question, but I have a lot of these thoughts here. Like, is it, like when you determine returns, right? I'm sure it's not just cost, so it might also be returns. Do you think in terms of the number of students affected? Do you think in terms of like liability savings or like kind of like other cost savings, you know, like students dropping out or something? Do you think in terms of academic outcomes? Like, so which goods are you maximizing when you make your investments? You know what I'm saying? Thank you
I know
for
what you're saying.
that long-winded question.
So I can kick that off. You're right. Basic needs was not on the scene as of probably 5 years ago. Basic needs has always been an issue in higher education, right? But we've always known of, you know, the starving student, and so it's always been there. But as of 4 years ago is when it really picked up momentum. Part of that was a grassroots effort from students to say, this is not okay. I should not have to be going through this. I need additional support. If you want me to stay, retain, graduate, and move on and be successful, I need more support. This is not the college of, you know, in the 70s and 80s when my parents were going to school and they could take out a loan and work part-time and pay off all of school and graduate with little or no debt. We're in different times. So I think part of it is the grassroots effort. The other part of it is really policy, the policy piece. So similar to what we've seen in tobacco work, when policies are set, that's really how you also change environments, and that's how you change narratives, and that's how you almost make that healthier choice the default choice. So I think with policy in this regard, like for basic needs, you know, the students were marching in Sacramento. They were going to officials' offices and having those sit downs and really saying, we need this. And also the 3 systems, public education systems, higher education systems in California, they banded together and they said, this is an issue that's affecting all of our systems. So there's strength in numbers. The UC system, the Cal State system, and the California community colleges have over 2 million students that they're servicing. And so that's a large population, it's a large constituency. And so you start to get people to listen when you're talking about that many students. There is, of course, thoughts about the retention piece, right? Because schools get money too based on how many students stick with it. So there is that component of, okay, what is the trade-off here? If we don't have these out of classroom supports, how are students gonna function fully? When I was at the CSU and I was going around to all of the campuses and kind of talking about basic needs, you know, in the beginning, I did get a lot of eye rolls, right? Because when you're on campuses and you're in it, there are a lot of burning issues. And you really do have to kind of pick which lane you're going to go in and focus your time and attention on, because you just, like you said, resources are limited, people are stretched, people are wearing multiple hats. And one of my former bosses, he made this statement that has always stuck with me. When you have multiple priorities, you have none, right? Because you can't focus on one thing. If you have all priorities, a priority means it's one thing that you're really honing in on. And so I think when we're doing work around collegiate recovery, I think Genie's right, there has to be this grassroots push, but there also has to be kind of, what is our solution? What do we need? We need to ask for it, and we need to ask for it fully. We need to champion this to Sacramento. We need to get some folks on board locally at some of our government officials, work with our government relations folks to say, we need this type of funding on each campus to help us with collegiate recovery. This is why it's important. There was studies put out by each of the higher education systems on basic needs to show. So we had, I think in the CSU, it was like almost 42% food insecure. And then within the UC, it was like 40% food insecure. So we were showing large numbers, if you scale and over that, 40%. And I think for the California community colleges, something like 60%. So we're talking about over 1 million students that were potentially impacted by this. So I think, there's a few things. One is the student voice. One is the policy piece. The other is, of course, the research to show like how this issue impacts student retention and what that means to the bottom line. Because unfortunately, that's a key piece of the pie too. Basic needs was within the WELL, our health education and promotion area, as you know. But then we got a lot of state funding. And the folks at, on each of the campuses really advocated for that. And to be honest with you, when I was in the CSU, because it's so large of a system, I mean, basic needs was important, but it was just kind of like, we have so many other issues that we're trying to deal with. We're trying to get more faculty, we're trying to have more classes so students complete in 5 years. Like, there were all these different pushes. So, my message when I would go to the campuses was, if you don't have these out of classroom supports, you're not going to have any students to teach, right? You're not going to have it. I mean, they tie together. These out of classroom supports are critical to student success and to graduation. And you have got to, we have to make that narrative and not make it that it's an individual issue, right? This is for all students. And so how do we change that? How do we shift that narrative? And it takes time, but with the right kind of mix of just the grassroots, the policy, the going and having these one-page resources and having that stump speech ready so that when you do get in front of those officials that have these decision-making power, you can hit them with it, they have it, and now that's something that's planted in them. So those are just a few thoughts. I know that was kind of rambling and long, but I'm sure Genie has other stuff to add.
I'm just smiling because Denise and I worked together in the CSU, and I remember when she was in her role and I was at Cal Poly, even when she came to visit just regarding basic needs, I had that little elevator pitch about collegiate recovery that I was giving to her when she came to visit. And so I absolutely agree with everything that Denise had shared. It's really about how do we leverage the collective impact of the work that's being done, but also demonstrate and find strategies. And I know we talk about, basic needs right now is really a hot topic for all of our campuses, right? And I know our basic needs folks are creating 11 different pods and expanding the definition of basic needs to include mental health and health equity and other strategies that support student success. And so when we look at it that way, where is that opportunity for us? And I don't mean this in a negative way, but to ride on the coattails of what basic needs is doing to put forth more energy, effort, and information regarding collegiate recovery as part of that basic needs initiative, right? You have to start somewhere and you have to be creative, although it might not be the primary, oftentimes we're like, what's the primary problem here in a public health situation? Is it basic needs and food insecurity primary and substance abuse and misuse is secondary, or is it vice versa, right? And I think it depends on what space you're in. I think it depends on who you have the opportunity to talk to, right? And how you weave in the opportunity to talk about collegiate recovery in the different spaces that you have a seat at the table. And then if more folks are doing that, then as different administrators or state government relations folks or our governor or other folks who are leaders in positions of power start hearing these messages, then there'll be more action and collective impact that's created to help support what the cause is and the effort is. And I think it's about mobilization and working collaboratively together to come to identify what those asks really are. So what are like the 3 main things that we know students who are in recovery need on a campus to be successful? I think would be how the work gets done as a collective and more advocacy.
Thanks to you both. Those are really helpful comments. I'll just share one reaction. I don't think that in our VCR discussions, we've talked much about sort of the social movement advocacy. We've certainly talked about advocacy, but more locally, not so much in terms of policy, the way you framed it, Denise. So that's really helpful, that maybe we need to shift kind of thinking about that it has to be more policy first, and then the funding will flow kind of thing. And then, Jeannie, your points too about mobilizing, and Denise, you made the point too, but about, how to mobilize for policy change. Anyway, thank you both for that. Other comment, Abhi, go ahead, share your comment or question.
I have a question for Denise. Could you tell me more, and picking up where Tanya left off, could you tell us about policies you have advocated at the state and national level and the process that this involves? Thank you.
Yeah, so one of the bills that I was involved with was the basic needs monies that came down from the state for each of the higher education areas, higher education institute, public. So the California community colleges received a certain amount of money, CSU did, and then the UCs. Part of that was coming up with a bill with the language in there being very specific about, okay, we're going to set aside these dollars to go into these kind of 3 buckets, similar to what Genie said, like what are those 3 asks? So one was that each of the campuses had a food pantry. Each of the campuses was to have some type of CalFresh food resource outreach to students. And then I forgot what the third one was. Genie, you may remember, but there was like kind of 3 asks that we put into this bill. Part of it was to, part of the effort was going to to briefings. So once you start in hearings, so you find out who is on these different committees in Sacramento and who can start making things happen. And so government relations at the CSU Chancellor's office, of course, had a government relations office there in Sacramento. They had really great relationships with different staffers and some of the offices of the assembly members. So Assembly Member Weber, you know, I forgot some of the other names there, but these were folks that were very interested in college, higher education, and kind of helping support students to get through. And so I remember the year that the basic needs funding came down, I mean, Sacramento was like my second home. I was there probably at least once a month, if not sometimes twice a month, doing briefings, walking the Capitol, going to talk to different staffers. And so after a while, you start to become kind of like the resident expert in that area, and they look to you. So when assembly members and folks start thinking about, okay, actually we have this small pool of money, you know, maybe it's $1 million, or maybe it's $500,000 or even $100,000, but we have this pool of money. And, you know, something that popped into my head, that lady who came and she talked about collegiate recovery, and maybe we can give them some money. That sounds like that. And so it also helps them look good, right? Because they're like championing, but they have the 1-page handout, right? That shows all the stats of why it's important. It shows, you know, you have students. After I would make my rounds, we would have students that would go up and they would talk about basic needs and different things. And this is why it's important. And so I think it's like, again, it's kind of multiple parts to it. Having the students that are mobilized, that you can have them making the case, and maybe starting locally. Have an idea for a bill that you can pitch to a local official. And then once they say yes to it, or you kind of work through the logistics of it, then they can champion up to the next level. Maybe they get somebody to co-sign on it. But like for our basic needs work, we were, you know, in the CSU, it was a big issue, but it wasn't the biggest issue. So there were, again, a lot of competing priorities. And I think we were still trying to get money for the graduation initiative that we had, which we were really trying to push students to finish in 4 or 5 years. So we couldn't go, you know, I wasn't, if you will, let loose all the way to really push for all the money that I thought we should get in the CSU. But on the other hand, we had the UC, and they had a little more latitude. So they really were able to push. And so that's how we were able to get money. The UC gets more money for basic needs every year than the CSU does, even though the CSU is double or even double and a half the size of the UC. So it takes also some of that top leadership, you know, at the different levels to really also champion it. At the CSU, we did have our Chancellor, Tim White, who was former UCR Chancellor, and basic needs was something important to him. In fact, he even said, he was on CalFresh food stamps when he was a college student. So that resonated with not only the students to say, wow, if he was there, it kind of knocked down some of the stigma. Wow, if he did it and look where he is now, I know I can do it, and we need to push for more support. And then also when he would speak to our direct board of trustees, or go to the hearings, and he would mention basic needs as being something that's integral and critical to student success, it just helped pave the road a little bit more. So that's kind of a long-winded answer, but really it's, I would say, starting with thinking of a policy, thinking about how much funding you would need, and maybe start, $50,000 or $100,000 per campus, or, can we pilot test this? Can we have some money to pilot test something? But really trying to start there with local, build it up. It'd be great to get, the chancellor or other leadership on board for the campus, or working with government relations office to say, we really want to push this. Or as Genie said, working with basic needs, maybe seeing if there's a relationship there, that we can also partner with. So it's multiple kind of tentacles that have to be put out there.
Yeah, and I would also add, just putting it into the context of the UC system, one of the things that I'm seeing happening is our local student government leadership right now is advocating for more mental health funding right now, right? And so I think what's important is to engage your student body presidents in the challenges or the issues that you're seeing, and ensuring that you're sharing the data, the information, and the reason why through those means. And that information trickles up to our UC regents, right? And the state legislator, and the students themselves within student government can also help support that. The other thing that I know that I have the opportunity to serve as is the liaison to UC Health as well within my role and my position. And UC Health is, in and of itself, an enterprise that has its own self-funded health insurance plan, right? And if our students can advocate for utilizing some of that UC student health insurance funds to pilot test or, pitch an idea about more resources on a campus, I think that would be another way to get some seed funding to demonstrate the need. So those are some additional ideas that are UC specific that I think we can all collaborate on and start discussing the strategy.
Great, thank you. I believe Anne had a question.
Yeah, thank you. So I'm on my cell phone and my cat is on my lap. I put a question, at least on my interface, it says there's a Q&A. So I'm just going to go ahead and read what my question was. First, I just wanted to say, this is a really great talk, and just all the information you've shared thus far has been really wonderful, both from Genie and Denise, so thank you. It really says to me that advocacy and political influence is so key, particularly here in the state of California. So what advice can you offer to bring recovery into funding for student mental health? And I asked this question, it builds on what Genie has just said, but also because I know that there historically has been funding for student mental health. Thinking about, I believe it was Prop 64, if I'm not mistaken, where it invested money into mental health, particularly for community colleges. And so I want to know if you could just kind of respond to that thinking around framing recovery really within the context of mental health.
Yeah, so what was passed was Prop 63, the Mental Health Services Act, and that's a tax that if you make a certain income over a certain amount, that tax is collected, and that funding is going towards mental health services within the state. And I want to say 3 or 4 years ago, the UC system actually was able to get some of that Prop 63 funding. We haven't in the last 2 or 3 years, but that's definitely something that our UC regents is really interested in exploring again. And so as we talk about funding and strategies for mental health, I think there absolutely is an opportunity to think about our prevention, early intervention, treatment, and recovery resources that can be written into those funds. I was just working on a summary brief, and most of all the funds that we've received on our campuses for mental health have gone primarily to treatment. And I was surprised, as a business model, I was surprised that we hadn't implemented the funds to address all tier 1, tier 2, tier 3, which is prevention, early intervention, and treatment, as we were going along over the years. But unfortunately, all of those funds went directly towards increasing the number of counselors on each of the campuses, which I think is absolutely important. But I think a strategy for success in order for us to support holistic health and well-being, like Denise was saying, is to invest in prevention, early intervention, and recovery as well. So it's definitely on the top of my mind. It's definitely something that we've been discussing at the system-wide level. And we absolutely welcome more feedback and thoughts on how we can best advocate for more funding for the other areas. But I think something that I was chatting about with Sharon Weber was this concept that, you know, substance abuse, substance use disorders oftentimes are coupled with co-occurring disorders. So, and the way into treatment sometimes can be through mental health and seeking treatment for mental health reasons. And so if we're able to find ways and strategies to think about it as a behavioral health issue and co-occurring disorders, then I think there will be an opportunity for more funding.
Yeah, and I'll add to that, you know, as far as advice on really trying to receive funding and whatnot around this topic specifically, I would say, organize. Really try to organize. And that's not just here at UCR, but really trying to create a movement across the system. Trying to advocate with the Board of Trustees for the UC system. Looking for to galvanize support in each of the kind of locales of the UC campuses, so that, you know, if we get somebody, you know, Assembly Person Medina here in Riverside, connecting with Shirley Weber in San Diego, you know, so that you're starting to create this network of policymakers that all have at least heard of what this issue is, and then they can start to kind of collectively, maybe even subconsciously, think of, hey, this is an issue that I've heard over and over again. Maybe they mention it to someone else in passing and they say, oh yeah, we've heard of that. We need to maybe try to put our heads together and see how we can, you know, move this forward. So again, you know, a lot of the work that we were able to get done in parallel, basic needs, mental health, has been how do we collectively start this movement and then build it up? Specifically for mental health, right before I came here to UCR, we hosted a county, because we found out, you know, the Prop 63 money, all that money for mental health is going to the counties. And they don't even think about the colleges as being in need of mental health funding, right? They think, oh, the colleges have it, they're good, they'll take care of their students. Not realizing that a lot of the campuses are really strapped and resources are not there to really enhance or boost mental health services. So what we ended up doing was having the first ever mental health conference to bring together our county partners with the CSU campuses. So what we did is we invited every county that we had a CSU in, or a neighboring county, and we asked them to come to Long Beach for just one day, and really for a half a day. And then we brought all of our counselors from each of the 23 campuses to come together and have a conversation on what are the supports that the county has, what can they do to help right now, what can they do to help down the line, what is a framework that we can put together so that we can help support these students, because a lot of the counties were not connected with the campuses. Maybe the campus reached out to the county and there was no response, right? Because the counties are very overwhelmed too. and they're trying to see how they can spread out their resources across a lot of times a huge swath of area. So I think just trying to be innovative, try to figure out how to kind of think out of the box. That was something that wasn't done before, but then once people came and they connected, it was like, okay, now I put a face to a name. Now we can talk. Now one of the things we said is we want you all to start meeting, once a quarter. And just start building that relationship. And so from there, some of the counties that were working with the campuses, they were very gung-ho, and they said, we have some of this, some programs that we can help you with now, but we're really interested to find out, what do you need on your campus? Is that us supplying you with a counselor once a week to kind of help with your ratios and be able to see some additional students? I know at Cal State San Bernardino, they have a counselor from the county embedded into their mental health services. So there's actually a person who is paid for through county dollars that has an office at the campus. So it's my advice is just to really organize, try to get the effort across the whole UC, try to build it up within your locales, connect the students so that they're all on the same page, take it up to the board of trustees, take it to local government officials, and see how you can start building from that way. And even if their counties have most counties have some type of recovery network as well. So even tapping into that to find out if they have pilot money or proposals that, you can apply for specifically for college students. And if they don't, make the case why this is important so that they will consider it in the future.
Thank you. Those that have not yet spoken, do you have any comments or questions you'd like to ask or share? And if so, feel free to just speak out. Okay, well, I have another question then. So a theme that has come up in the engagement work and the activities of the Voice in Collegiate Recovery is this idea of stigma. And so it is possible that the next steps will involve some research related to stigma. And I'm a faculty member, and I feel like, often the thought is peers when we're talking about college students, but part of what has come up in the activities where the community has expressed that stigma is an issue is with staff and faculty. And not staff necessarily, although in one of the sessions I went to today, this person was talking even about a counselor who kind of expressed things in a stigmatizing way. But so not so much among the helpers, but more broadly among staff and certainly among faculty. And I have to say, I've absolutely witnessed, I'm shocked by the comments that I hear. There seems to be a sense that students with problems, whether it be, and again, that's how they would put it, students in recovery or students that have mental health conditions or have basic needs issues, they need to leave and solve that problem and then come back. And so I was just curious to get your thoughts as administrators. Faculty don't, I'm going to say it, I don't think they're as motivated by students' perceptions as they are by their peers' perceptions of them, and certainly, administrators and policy and things like that. And so I just wanted to hear your perspectives on, what do you think the best way, how do we reduce stigma among faculty? And clearly, faculty, I'm talking about, and I mean that broadly. So I've done some work where even faculty talked about not being able to disclose their own either recovery pathways or their own mental health conditions. So it's not just about how faculty respond to students, although I think that's really important. And perhaps we need different strategies, but I think just more broadly, reducing stigmatizing ideas among faculty.
I think one of the things that can be integral to reducing stigma amongst faculty is this idea of empathy mapping, right? And And if those of you who aren't familiar with it, it's a design thinking approach to kind of overcoming some of these challenges or barriers that folks might have, whether it's stigma with mental health or stigma with substance use disorders or students who are in recovery. And, you design your intervention or your campaign around empathy mapping for understanding what that person has gone through and understanding why there may be some barriers on the faculty side of not wanting to, maybe they're just too busy, maybe they're just tired, maybe they're overworked, maybe they have too much research that they're dealing with. But one of the things that I'll go back to a CSU example that we were all required to do as receiving funding for our basic needs funding was implement a education campaign to reduce the stigma related to basic needs. And so our campus would go and do these faculty presentations to talk about what the problem was. We had videos that, depicted a student who would be living in their car, right? And that they would go completely unnoticed and you would have never known that that student was homeless. Or, the same can be said about a student with an invisible disability or having a mental health issue or having a substance use disorder, and I think what's important is being able to understand the barriers of why faculty may be resistant to supporting, but then also giving them the tools and the resources to be able to support students. So one of the things that we had developed was a syllabus statement. So we requested and actually went to the Academic Senate to ask them to approve a message that would go into a syllabus statement that would support students with their basic needs. So I think in finding different ways to educate faculty, to bring them into the conversation and understanding, what folks, walking in their shoes may have experienced, or also being able to talk to them about, have they ever had a friend or a loved one who has experienced with this, and being able to find common ground in talking about these challenges, because 9 times out of 10 somebody does have somebody that they know who has experienced this or may be experiencing it themselves. So I think part of it is having those crucial conversations and being able to establish trust to have those types of conversations.
Yeah, and so to piggyback off that, I think in my experience, similar to what Genie said, some things to add to that. You kind of touched on it, Tanya. Folks have their own traumas. So I think part of it is, first of all, acknowledging that some faculty members have trauma around these issues. And so when you bring them up, it can elicit a sort of response in defense. And you might not even, you may not know, you likely don't know, but they can kind of recoil because of that. So I think I know with even basic needs, if I was to receive, the feedback of, oh, well, when I was in college, I was a starving student, no one helped me, my first response would be like, I'm sorry you had to go through that. That you shouldn't have had to go through that, because I think a lot of times things have been brushed over and no one heard when they had issues or they didn't feel supported. So their immediate reaction is, well, nobody helped me, so why should I help the next person? They can pull up by their bootstraps just like I had to do. So I think acknowledging the trauma that could have happened with certain faculty members. The second is, you have to get in folks' face. I think it's easy to turn a blind eye, but I know, issues that we see as core or critical or that we think are really important, faculty members, sometimes they just don't see it for one reason or another. For instance, I was talking to a faculty member. I did a presentation to the Academic Senate when I was at the CSU, and this was the Academic Senate from across the CSU. And so after I did my presentation, I mean, they peppered me with questions and, you know, data, and so afterwards I had a faculty member come up to me and said, I had no idea this was an issue. And one of the things I said in my presentation is like, you know, you need to shift how you view students. The student in the back of the class with his hood on and, you know, sleeping or whatever, may not be that they're just a slacker, right? They could have been working. They could have not had a place to stay. Maybe they got kicked out. Maybe they slept in their car and then they were told to move from where they were parked. And so, you know, you don't know what types of things that are going on. So I think being in the faculty members' faces and really pushing these issues and saying, this is not something we should or can turn a blind eye to is important. I know that's hard because, you know, the deans have meetings and try to bring faculty members together and everyone's so busy and it feels so stretched, but I think that's a cop-out. So I think being able to really get in there, have these tough conversations, even if it's 5 to 10 minutes, you know, say your piece, and really be ready to when you are challenged, be ready with your information so that you can push back on maybe some of these notions that the faculty members have. The other thing is to have like a one-page resource or some type of resource guide, because sometimes for faculty members, it's just out of their wheelhouse. You know, a faculty member in the School of Engineering or in mathematics or in chem, they may not feel comfortable talking. I mean, it's awkward, you know, there might be cultural differences or barriers and they just, you know, students talking about that and they're just like, I don't know what to say. It makes me feel, you know, weird, or it makes me feel like it's, you know, personal. Like, I don't know what to say to that. So just having something where they can, you know, turn around and say, can this help you? This is a flyer. Can you just take this? Or it's a business card to so-and-so in the basic needs office. Maybe you can talk to them. Or this is so-and-so case management. Just go to them. They can probably help you. But that's why we have to really arm our faculty folks and our staff with what are the appropriate resources, so that they feel like when they are put in a pinch or they are asked questions by a student, or they just feel like there's kind of an issue that they don't feel apt to handle, that they can appropriate referral, give referrals to the student. And then the last piece, kind of what Genie touched on, is policy. So, you know, the Academic Senate, you know, we put forth, similarly to what Genie was saying, we wanted to get a syllabus statement for across the system, like all of us, all faculty members, we want you guys to put this one-liner on. And I was actually shocked because a lot of the faculty members said, no, that's infringing upon, you know, our rights as instructors and faculty. We shouldn't have to do that. And so sometimes there's got to be more subtle ways to do it. Sometimes heavy-handed is not the way. So coming from the Chancellor's office to say like all faculty members are going to do this, even the ones that want to do it, it just feels heavy. But if you can get the students, again, to mobilize and say, this is something that we think is very important and present it to the Academic Senate on each individual campus, then that is a grassroots movement. That is a way to coalesce around an issue and then get it to where it's a policy where you have this, at least a start where students know, if you have this in the syllabus, my faculty, they must care, or someone here cares. So it's starting to kind of lessen that barrier of the stigma, like, oh, I can't say anything, or what are people going to think? They don't have to say anything to you. You know, it takes the onus now off the faculty. I don't have to, hey, there's this link in the syllabus. I suggest you click on that and you get the information that way.
Thanks to you both for those answers. Would anyone else like to ask a question or make a comment or share a reflection? Yes, Kyle, hi. So I think.
Hey, sorry about that. And apologies to everyone for coming a bit late today. But thank you for all of what you've shared. And I just want to, it's more of an experience comment based on what Denise just shared. Since I've been at UCR and found out about the Healing Highlanders, I've been including that on my syllabus, and students have actually reached out and talked to me as a result of doing that. But another thing that I hadn't really thought about it until listening to to you all today was when I was a graduate student in my first class ever as a master's student many years ago teaching a class. I had my student reach out to me after class and break down and admitted that she was pretty sure she had a problem with alcohol. And I mentioned some of the resources on campus that I knew about and asked her, you know, and I shared that I was in recovery, which for her was like this, she said was this really powerful moment. But the only reason she said she reached out to me was because I was the youngest of her instructors and she was terrified to ask her older faculty. So as a grad student, she felt comfortable approaching me. And I'm not sure if maybe it actually makes sense too to be more open with our grad students and let them know about those resources in case they're the ones that the students reach out to because they feel more comfortable sharing with them. In any case, thank you for sharing everything you shared just now.
Thank you for that. And Kyle, what that made me think about is it might be useful, you know, to identify, you know, faculty ambassadors. And that may include the young ones. You know, I mean, you would do your research to find out, you know, who people find approachable or what, you know, how do they pick and choose. And I certainly know that, I mean, I always tell students, you know, when they come to see me that I'm so grateful that they came to see me as their professor, because I know it can be scary, because when I was in college, I always went to the TA. I never went to the professor. And so I try to, you know, reinforce that they had the courage and bravery to come to the professor directly. So yeah, thanks for that comment. Did the panelists want to comment or add?
I just love this. Oh, go ahead, Denise.
No, go ahead, Genie.
I was just going to say, you brought up a good point about the TAs, and I think, you know, something that has been successful in other areas are these ally programs or, you know, advocate programs, right, for any type of struggle that a student might be going through, right? And so if there's a way that you can capture just creating a safe space for a student to come and approach someone, it can be the big difference between that gatekeeper that can help support that student in connecting them to services and resources. That just immediately reduces that barrier of feeling comfortable, you know? Like, I love that concept of ensuring that TAs and faculty have, you know, rather than, I forget what it is, it's not office hours, changing it to something else that's like faculty hours where you can come talk to me rather than I'm doing office work and you're interrupting me, right? Even just the slightest shift in language can be the difference between a student feeling comfortable coming in and talking to someone.
Yeah, I think just to piggyback off of that, you know, one of the examples I gave about, you know, our chancellor at the CSU when I was there, you know, saying, hey, I was on food stamps when I was in college. I wouldn't have gotten through without that, was pretty mind-blowing for a lot of our students who saw him as a figure in authority at the highest level and had been where they are currently. So I think having that, and that's why I think it's so important, like, to have like that syllabus statement or something. And that way it doesn't necessarily put the faculty member, if they're uncomfortable talking about it, or maybe, you know, they don't understand or they don't get it, at least there's that, so that they can at least route the student to the right and appropriate resource. But I agree. I think faculty, alumni who are, you know, have recovered and have made it and are living a very full life, being able to hear from them and their struggles. We often don't hear about their struggle. And everybody goes through the struggle, different types of struggle, and the struggle is real. And so I think a lot of times, you know, we say that kind of cheeky, but it's the truth. And we don't talk about that. We only talk about the success. But we should be sharing more about the trials and tribulations that we've each had to go through to get to where we are today.
So we are at time. I want to thank our two presenters, Denise Woods and Genie Kim, and to all of the attendees for being present and sharing your ideas and thoughts. Thank you very much. And the copy of this recording will be available on the conference website. I don't know if it's Huva or Wova, I don't know how to say it. So if you want to follow up or, you know, look back or share it with anybody, it'll be there. I'm not sure if it'll be available more publicly or just to conference presenters, but in case anybody else asks who's at the conference, they can see that there. But thank you very much. I hope you enjoy the rest of the conference. Thanks, guys.